So our topic tonight is nutrition for sports injuries and rehabilitation. I'm excited to introduce you tonight to our presenter, Dr. Geoff Lecovin. Let me tell you a little bit about Dr. Geoff. Dr. Lecovin is a chiropractor, naturopathic physician, and acupuncturist. He graduated from the Los Angeles College of Chiropractic in 1990 with a Bachelor of Science in Biology and Doctor of Chiropractic. He earned a Master's of Nutrition from the University of Bridgeport in 1992, and then went on to complete the Doctor of Naturopathic Medicine and Master's in Acupuncture programs at Bastyr University in 1994. Dr. Lecovin completed another Master's in Exercise Science from California University of Pennsylvania in 2015. He holds additional certifications in exercise and nutrition from the National Strength and Conditioning Association, International Society of Sports Nutrition, International Olympic Committee, and National Academy of Sports Medicine, where he's also a master instructor. Dr. Lecovin specializes in treating musculoskeletal pain and sports injuries by integrating trigger point acupuncture / dry needling, soft tissue release, joint manipulation, corrective exercise, and nutrition. So as you can see, this man is a wealth of knowledge. Thank you for being here tonight, Dr. Geoff. His office is located in Kirkland. It's called the Northwest Integrative Medicine Practice. So I will, at this point now, turn it over to you. And Dr. Geoff is going to share his presentation with us. As I said, please feel free to ask questions along the way, and I will do my best to get every question answered. So over to you.
Great. Well, thanks for having me. And as we go through this presentation, you're going to see there's an underlying theme. It's a food first approach, or talking more about how to use food to heal. And one of the things that I found as I have been practicing was that one of the missing links in healing injuries is nutrition and inadequate nutrition. And just like you can't out-exercise a bad diet or outperform a bad diet, you also can't out-rehab poor nutrition. You need to have those building blocks in order to heal. So hopefully you'll get some information on this presentation that will help you if you have an injury, or even to help prevent injuries as well. Okay. So some learning objectives here. So this presentation actually was put together partly as a project from a diploma that I went through in sports nutrition. And it was obviously for nutrition and injuries. And I also put it together for a course that I'm teaching online. So some of the information is geared towards healthcare providers, but a lot of it you'll be able to use for yourself if you're not a provider. So I want you to be able to use the information to apply a nutritional pyramid, and you'll see what that means in a moment. But it's a pyramid of prioritization, meaning what's the most important thing that you want to consider, and how that leads up to things that are important, but maybe not things that you should focus on. And then we'll look at the different building blocks of that pyramid. So energy, meaning calories, macronutrient needs, so carbohydrates, proteins, and fats, micronutrient needs, your vitamins, minerals, and phytonutrients. Looking at nutrient timing and periodization of nutrients. So when should you consume certain nutrients? And again, learning a food first approach. And then lastly, a little bit about some supplements for repair. So the research, where does the research come from this? Well, unfortunately, you can't take two populations and purposely injure one and then compare it to another group or a control group. That wouldn't be ethical. So a lot of the research for this comes out of extrapolation. So we're looking at data from the elderly population. So what happens when people are immobilized? What happens to muscles? So for example, if somebody's been in a cast or they can't move, what goes on with the muscles? How does that affect your nutrition? And then looking at healthy population and also some animal studies as well. So I have a lot of the references at the end of this presentation. So if you're interested, I can always get those over to Courtney, and you can take a look at those, but I also have some resources as well. Okay. So again, this is going to be a food first approach. So when you're looking at diet, it's important to get a well-balanced variety of different foods, lots of color, eating a rainbow of foods. Um, I'm not an extremist when it comes to diet, so I like to look at more of a balanced, anti-inflammatory way of eating. So you're going to get that from colorful fruits and vegetables, from grass-fed, pasture-raised meats, um, meats that aren't fed with hormones, and wild, preferably if you can get that as well. Whole grains, healthy nuts, and then at the bottom right, supposed to be fermented foods. And there's some good information out there on fermented foods and how the gut microbiome affects muscle repair, and even how it can affect your training adaptations. So obviously the number one thing you want to do is prevent things. So the way you can prevent potentially your susceptibility to an injury is making sure that you recover appropriately. So we're looking at the R's of recovery. So after you are exercising or even during, make sure you're adequately hydrated. So that'd be rehydrate, replenish your muscle glycogen. So making sure you're getting enough carbohydrates depending on how long you're exercising. And generally the carbohydrate requirements for an endurance athlete are going to be higher than for a strength athlete, but we're looking at anywhere from 5, 6, up to 12 grams per kilogram of body weight, depending on your event and training intensity. And then we want to focus on protein afterwards for repair, and then revitalizing with all those nice colorful fruits and vegetables and good sources of protein. And then obviously rest as well. From a musculoskeletal perspective, for prevention, in my practice, what I do is I look at the overhead squat assessment, and this has been shown to be a good way of assessing somebody's movement patterns. So if you can look at the diagram on the left showing this person squatting, there are 6 major kinetic chain checkpoints. So you're looking at your foot and ankle, your knees, your lumbopelvic hip complex, your shoulders, and your neck. And if you look at somebody squat from the front, the side, and the back, looking for deviations in all the different planes of motion, if somebody has a deviation, then you can break that down by looking at their range of motion and doing some muscle testing to determine where their imbalances are, and then use a corrective exercise type of protocol. This one happens to be from the National Academy of Sports Medicine. And so essentially, when somebody has muscle imbalances, they're going to have a combination of overactive muscles and underactive muscles, which is going to result in faulty movement patterns and predispose somebody to injury. So you can inhibit or stimulate muscles through pressure, like foam roller or tennis balls. And then once that inhibition occurs, it stimulates receptors in the muscles to relax. And then you can lengthen a muscle through a static stretch. And then the other side, you can activate or turn on muscles that might be weak through some isolated types of exercises. And then you integrate motor patterns or whole body types of motions. So let's talk about the repair process. So there's a normal repair process that occurs when you have an injury. So we start with inflammation, then there's regeneration, and there's fibrosis. And this occurs over a certain amount of time. Now, a lot of times people will see inflammation as a bad thing, and consequently, there's a rush to use anti-inflammatory medication, whether it's an NSAID, or use ice, or use even things like curcumin or turmeric, fish oil, high doses, and so on. And the problem with that is that, let's get back here. This is a process, and your body's doing what it's supposed to do. And inflammation actually is a way that your body signals certain things to happen. You have the production of different chemicals, and these chemicals cause things like vasodilation, vasoconstriction, and bringing lots of blood to the area. So you have nutrition coming into the area, and you have waste products leaving the area. So why would you want to block this process? And I would even say, why would you want to use ice as well? Because it can block the process as well. So we'll talk about some other things that you can do to help with inflammation, the good effects of inflammation, and maybe lessen some of the uncomfortable effects or the painful effects of inflammation. But if this process doesn't occur, then the healing process is going to be suboptimal. So basically, inflammation occurs pretty much right afterwards for up to 5 days, and then you have the proliferation or regeneration phase that occurs for a few weeks, and then maturation that can occur for a few years. So again, this is a process that your body goes through in order to heal, and if you don't allow the process to occur, then it's not going to heal properly. And probably what's going to happen is you're going to end up having chronic pain or chronic recurrent injuries. So with acute pain, that's that inflammatory pain that occurs right away, and it's typically characterized by redness, swelling, or we can use the acronym SHARP: swelling, heat, altered function, redness, and pain, SHARP. And so when you have that acute pain, the first thing somebody wants to do, and the old wisdom that we had was to use rice. And I think that to a certain extent, a lot of people are moving from rice to meat. Sorry for your vegans out there. No, MEAT is another acronym that basically stands for move, exercise, analgesia, and therapy. So basically getting somebody to move, notwithstanding maybe an injury where there's some instability. In that case, obviously you do want to protect the area, but movement and exercise and therapy helps to get things moving and going again, gets the nutrition in there and gets you back to play or back to what you're doing for your event. Analgesia could be a topical thing. So it could be something like BioFreeze or some kind of herbal liniment or CBD cream or something that might help to dull some of the pain receptors, but at the same time not stop the healing process from occurring. So what happens when you immobilize an area? And again, this is taken from research that's done on elderly population. So basically, when you are immobilizing an area, the protein synthetic response of the muscle is compromised. So what does that mean? So basically, you want to have muscle protein synthesis. That's how your body increases muscle, and that muscle is necessary for repair. But when you immobilize an area, you have a reduction in that protein muscle synthesis, as well as a decreased sensitivity to the availability of amino acids or the building blocks of protein for repair. So two things happen. You have a reduction in muscle protein synthesis, and then the muscles are not as sensitive, so you need to get more protein in there in order to facilitate that repair. So I'm not going to get too technical here, but basically there are two studies here that show that on one side here, you have a quadricep tendon cross-sectional area where it's not immobilized and there's no disuse or atrophy, and then the other one where it is immobilized, there's a loss of muscle. And same thing on the graph or the bar graph on the right. So in terms of focusing on nutrition to support healing and repair, so we're looking at the areas that are primarily injured, so muscle, tendon, and bone. From the muscle perspective, we're looking at protein, specifically branched chain amino acids and essential amino acids. And we're going to break all these down as we go through this presentation. HMB, which is a metabolite of leucine. I have it in brackets because it's one of those things where you might hear about HMB, but in reality, the research really shows that if you get the branched chain amino acids from a good quality source of protein, you don't need to be taking supplements like HMB. Omega-3 fatty acids, commonly found in fish oil and flaxseed oil, is also important for maintaining muscle protein synthesis. Creatine, which you might have heard of, can be helpful, and then polyphenols found in things like tart cherry juice can be helpful for muscle repair. From a tendon perspective, we're looking at things like collagen and again protein to enhance tendon repair, and then things that will increase nitric oxide, which will increase blood flow. So we're talking about nitrates like beetroot juice and chard. Arginine is another one, and citrulline malate. From the tendon repair, my favorite is to use is just plain old beetroot juice. And then from bone, we're looking at protein, carbohydrates, calcium, and vitamin D. So the single most important nutritional thing that I want you to understand is that you want to you want to avoid nutritional deficiencies. And there's a study by Tipton, and I have it at the end of my references, that really points to you can't just take extra vitamins and minerals and nutrients and say that that's going to enhance the process. It's only going to enhance it when you have a deficiency. And that would hold true for a lot of different things, especially right now when we're looking at what's going on with this epidemic we're going through, and people taking high doses of vitamin D and vitamin C and other nutrients. Really, unless you are deficient, taking extra things or extra amounts or pharmacological doses isn't necessarily going to cause you to have an enhanced immune response. It's really making sure that you have sufficient nutrients. So the goals of nutritional intervention is to support the healing process, prevent deficiencies, maintain energy balance, support muscle, protein, and connective tissue repair. Sorry, that's muscle protein synthesis. Preserve your body mass. You don't want to lose lean body mass, and prevent gaining body fat. So the diet in general should be a well-balanced diet, whole unprocessed foods. It should be carefully assessed and reassessed throughout the process of healing, and changed as things change. So for example, you might want to modify the amount of carbohydrate near the beginning of an injury or beginning of the healing phase, and then as somebody is starting to be able to exercise more, then maybe increase that particular macronutrient. So the idea that a lot of people, and this kind of goes back to like populations like strength athletes or bodybuilders, looking at isolated foods. So for example, a lot of people would focus on egg whites, for example, as a source of protein. But I would encourage you to eat the whole food and have more of a whole foods type of diet. There was a great study that I've cited here where they compared muscle protein synthesis after consuming just egg whites versus the whole egg. And they found that there's a synergism between the fat and the other nutrients that's present in a whole egg that's not just present in the albumin. So really consider that whole food type of diet. And a lot of times people want to isolate a specific fraction of the food. And again, my preference is to use a food first approach and eat the whole food. So this is taken from Jack and Droop. He's probably one of the premier sports nutritionists out there. And it's a way that a lot of sports, well, I wasn't going to say sports nutritionists, but a lot of trainers or the general public will approach nutrition for an issue, whether it's a performance thing or recovery. And a lot of times what happens is that the emphasis is placed on a pill. What supplement can I take to get better versus a balanced diet? And so if you look at the diagram on the left, that's kind of a shaky foundation versus the pyramid on the right, where you have a balanced diet, and we're going to spend some time talking about that, and a little bit on top of supplements. And really, supplements can play a role, but you can't out-supplement a poor diet. So here's a pyramid broken down a little bit more. So at the foundation, we're looking at energy balance, getting the appropriate amount of calories in. So if you're not getting enough energy, and we're going to get into this a little bit more because it's really important, you're not going to have enough nutrients to heal. So those nutrients come from the macronutrients, carbohydrates, proteins, and fats, and then micronutrients, the vitamins, minerals. And then as we get up there, you'll see that the pyramid gets smaller and smaller towards the top where you have the supplements. And nutrient timing, while once was thought to be like really essential, now is believed to be more of a garage door rather than a narrow window. But I would say that in terms of injury repair, if somebody's coming to my office for injury treatment, I would encourage them to consume specific nutrients before they come in to see me, maybe an hour before, because what I do creates a sensitive target to the area. And if the nutrition is available, then I think it's more effective for the healing process. So as we go through this, we want to think about total type and timing of the nutrient. So how much of a certain nutrient, what type of that nutrient, and how we want to time it around the rehabilitation process. And you can use the same idea around your training. So if you are training for a certain event, how much carbohydrates, proteins, and fats should you consume? You might consider training low in a scenario where you're trying to increase mitochondrial biogenesis. So you're training in a state that's low energy, slightly and low carbohydrate availability, and that forces your body to create molecular signaling that will help you to increase mitochondrial biogenesis. So when you have a lot of carbohydrates, then you're in a better place for performance. So, and then I think with the type, we're looking at specific types of macronutrients. So the type of proteins, the focus on proteins higher in leucine content. And then when it comes to the types of carbohydrates, whether it's a low glycemic or high glycemic type of carbohydrate, in general, for healing from an injury, I recommend having more of a lower glycemic, higher fiber, more complex versus a higher glycemic, which might have its role when you're completing a marathon and need to have a maintenance of your glycogen stores. And then timing, we'll mention in a little bit. So when we talk about energy, so we're looking now starting at the bottom of that pyramid, we need to figure out what someone's energy needs are. And so we want to look at your total daily energy expenditure. And so we can determine that through different calculators. The primary part of this equation comes from your resting metabolic rate, which is kind of set based on your age, your gender, your height, your weight, your body composition, and to a certain extent, things like thyroid function and maybe some kind of illness. So that plays a major role. And there are equations that you can use where you plug in some of these things and it'll come up with a number. And then on top of that number is the activity energy expenditure. So that would come from exercise, non-exercise activity thermogenesis. So things like fidgeting, walking, doing the laundry, that kind of stuff. And then there are injury considerations. So when you have an injury, your body requires energy in order to heal. So if you're in an energy deficit state, that's going to adversely affect your healing. And the last part of this equation is a thermic effect of food. So that's where you can use the idea of a higher protein type diet, which basically, if you were to take, say, 100 calories from Captain Crunch and 100 calories from a piece of grass-fed steak, even though they're the same amount of calories, they behave differently in the way that they're digested and assimilated, and there's a bit of an energy cost. So these are considerations that I'll look at when somebody is healing to help guide me in how many calories are appropriate during the repair process. So basically, after you have an injury, the energy needs could increase. Maybe you're using crutches, and that can increase your energy expenditure significantly above what you would normally have during regular ambulation with walking. And again, as I mentioned, injury healing might require more energy. And also you might want to consider a small amount of weight gain that might be important to enhance muscle protein synthesis and to minimize atrophy, which at the beginning I showed you could be of consequence in terms of the healing effect and your body's ability to be sensitive to the nutrition that you give it. So again, to determine your energy balance, you can look at online calculators. We talked about the thermic effect of food and how protein can be a macronutrient. And this would be more of a strategy when we're looking at weight loss. Maybe if somebody's looking to lose weight but maintain lean body mass, for example, you can be in a hypocaloric state or a low energy state and increase your protein, and that will help to save you from losing muscle. And then looking at, in terms of performance, energy balance is important for not only for muscle healing, but also for your training to meet your training goals. So here's some links to some of the calculators that I've used. So you can just plug it into a search engine if you're just kind of curious after this presentation to figure out what your energy requirements would be. And a lot of these calculators also have a TDEE, so a total daily energy expenditure calculator. So that would take into consideration your basal metabolic rate, and then you can plug in a number that would be based on your training intensity and frequency. So, so there's two terms that I want you to become aware of. The one we've been talking about mostly here is energy balance. So basically, that's the relationship between the calories coming in and your energy expenditure. So obviously when you're in a positive balance, you're going to have more coming in than coming out, than going out, then you're going to have potential to store. And then when you're negative balance, you have less coming in than going out, and then you're going to have potential to lose body fat. But energy availability is another term that's important, and that's the amount of energy that remains after your training for other metabolic processes. So it's also the energy that could be available for your healing. And you may or may not be aware of a new term out there called relative energy deficiency in sports, or REDS. We're going to talk a little bit about that, because not only does it apply to your ability to train and perform, but also to your ability to heal. So when we look at this REDS phenomenon, you're probably familiar with the female triad, where you have menstrual dysfunction, bone health, disordered eating. You can see that on the right side there. But when you don't get enough energy, so you're not consuming enough calories, and a lot of people will think, I'm injured, I can't train as hard, I need to reduce my calories. But what happens is, not only do you have, if you're a woman, it's going to adversely affect menstrual function, but it'll affect bone health for both sexes. It has endocrine effects, metabolic effects, blood effects, growth and repair, which you want to have for healing. It'll affect your mental emotional health, your digestion, and your immune function. So as we're going through, again, this COVID crisis, being in a low energy state is probably not the best place for your immune system. So I don't want you to get too caught up in these numbers, but basically these are how, or this is how energy availability has been defined based on your, the number of calories per kilogram fat mass per day that you take in. So up at 45 is known as energy replete, or that's where you want to be. And then as you get down in these lower figures, that's where you can have an energy deficiency. So, and I'm going to show you what that means in a second, a little bit more, hopefully hit home a little bit more. But basically you can see, like, as you start to go down in increments, it can affect, things like optimum reproductive potential or health for women. But I think this slide here kind of puts it all together. When we're at the normal energy balance, you have normal function, and it doesn't take much of a deficit to reduce thyroid function, insulin growth factor function, luteinizing hormone as we get even lower. Now we're starting to get into bone issues and disrupted menstrual function. And then also for men, you're going to have testosterone problems, whereas women would have the estrogen problems, and so on. So you can really see that it doesn't take much of a deficit to adversely affect your ability to heal, and also affect your metabolism. So you can see, like, people who are in a low energy availability scenario, that's going to affect your metabolism really, really significantly by affecting your thyroid function. So just by being in that low energy state, you're going to burn less calories at rest. But getting back to the healing part, thyroid's also important in metabolism, and that metabolism is important for your healing as well. So just to kind of bring this home, it's just important to make sure that you have enough energy coming in from your diet. This isn't an uncommon issue. It's been found to be 22 to 58% of athletes, both men and women, probably more predominant in women. And certainly there are different sports where this would be more of an issue, but it's something that I want you to be considering. And there's a link to this categorization, if you will, of people who are at high risk, moderate risk, and low risk based on their behavior. So if you're interested in that, there's a link there you can get to. So basically the treatment for this is basically reverse the low energy available scenario by increasing your energy intake and decreasing your activity. Generally by increasing your energy intake by 300 to 600 calories per day throughout the day, and then also addressing any psychological issues that might be part of this, whether it's disordered eating. So maybe like a multidisciplinary approach might be needed if this is like a really serious thing that we're dealing with. From a macronutrient perspective, now we're working up that pyramid. So let's assume that you've got enough energy coming in, or at least that you now recognize the importance of that. What are macronutrients? So macronutrients can be obviously energy substrates from a scientific perspective. They supply energy for different activities. They're also signaling molecules. So, but what I mean by that is that when you take in a nutrient, it will signal certain proteins to create some sort of event or something to occur. And we'll talk about that. It'll make more sense in a little bit. But most of the time you think of nutrients as supplying energy or having some role in repair or inflammation. And that's true, but we also can look at them as creating an adaptation, especially in conjunction with rehabilitation and training. So with carbohydrates, primarily we're talking about fruits and vegetables and whole grains. It's the primary energy source that you're going to use for moderate to intense activity. So if we look at this thing called the respiratory exchange ratio, it's how you exchange carbon dioxide and oxygen while you're active. So just sitting here right now, not doing too much, assuming you're not on your Peloton, you're going to be burning fat. And as you increase your energy expenditure or your intensity, you start to move from a mixture of fat and carbohydrate to more burning carbohydrates. So that's why somebody who's a CrossFit athlete is not going to perform as well with a low carbohydrate diet, and especially an endurance athlete, you're going to want to be on a moderate to high carbohydrate diet depending on your intensity and activity. So from an energy perspective, carbohydrates will supply 4 kilocalories per gram. That's not that important, but I just wanted to just throw that in there just so you can see how many calories you get from carbohydrates, and I'll do the same for proteins and fats. There's 2 different types or classifications, if you will. There's a high glycemic, which causes a kind of a rush in blood glucose, and that's where we're talking about simple sugars or some of the drinks that you might have, like the mixtures of solutions that you would drink if you're on a bike or running in order to maintain your glycogen stores. And then there's the low glycemic carbohydrates found in whole grains and high fiber starchy vegetables, which if we look at the high glycemic, they tend to be energy dense, whereas the low glycemic tend to be more nutrient dense, and that's going to be important for the healing process. So this just kind of gives you an example of different foods that would be considered high and low glycemic index. There's also this idea of glycemic load. That's what GL is. So basically, a food can have a high glycemic index, but a low glycemic load, meaning while it could have that spiking effect, you need to have a lot of it. So, and the other thing to consider with this glycemic idea is that we generally don't eat mono foods. We generally will have a plate of food that has different macronutrients in it. So for maybe you might have a steak, some sweet potatoes, and a salad. So that whole glycemic response will change to some extent. But if you are, again, consuming a lot of like sport drinks or refined carbohydrates, it's probably not a good idea in the context of healing and repair and having more of an ideal energy intake. So from a dosing perspective, so basically they used to recommend macronutrients more from a percentage, but the International Olympic Committee and some of the other international associations have gone more to a periodization and a matching approach. So basically, if you can look, and I talked about this a little bit earlier, your intake can be based on how much activity you're doing up to extreme activity. So from the reason why I have the blue 3.3 to 5 grams per kilogram body weight is because that's probably what you want to aim for when you're in the healing and repair phase, versus if you're training a couple times a day for a triathlon, you would have up to 12 grams per kilogram body weight. So the recommendations, so basically your primary fuel during this time should be carbohydrates, so you can have the protein that you take used for healing and repair. You want to keep your needs at that 3 to 5 grams per kilogram body weight to prevent excess weight gain. Focus on whole foods, whole grains, fresh fruits, and vegetables, lots of color. Choosing hopefully more low glycemic foods and avoiding things like the sugary beverages and concentrated sweets. And as I mentioned at the beginning, some weight gain might be preferable to support muscle protein synthesis, but it's going to be individual depending on the person. Certainly, if somebody goes into an injury underweight, it could be one of those circumstances where you want them to gain a little bit of weight. From a protein perspective, now we're talking about chains of amino acids. Protein functions differently than carbohydrates. It's not really a fuel. Ideally, it's more of a kind of a molecular signaler, if you will, helping with DNA, transporting different molecules. And then the big thing for repair is this idea of triggering muscle protein synthesis, or this signaler called mTOR. And so, and that's going to be important as we go along for you to understand that idea of consuming foods that are rich in leucine. And so certainly you can see I'm kind of got more of a carnivore idea on the right there with all those different foods. You can certainly get leucine from plant-based foods, but I would say that there is a bit of an energy balance, if you will, idea where you would have to consume more energy in terms of calories to get the same amount of leucine, for example, in a piece of steak versus some quinoa. So protein, just like carbohydrates, provides 4 kilocalories per gram. And then there are this idea of complete proteins and incomplete proteins. So for the most part, animal products have all the essential amino acids. So you have this idea where you have leucine, which is the trigger for muscle protein synthesis. Leucine is one of the branched chain amino acids, along with isoleucine and valine, and that you want to have all the essential amino acids as those building blocks. So just taking a branched chain amino acid is not going to be effective or advisable. You want to take a complete animal source, so getting that whole food. Here's where I would say, like, supplementing with whey protein would be helpful. And there are certainly some plant-based proteins, like Vega has a sport protein that's a pea and rice mix that has a good amount of leucine, like that 3 to 5 gram per dose serving. And then plant products have more of an incomplete, which doesn't necessarily mean that you can be you can't heal being a vegan. There are just considerations where you want to make sure that you're getting all the appropriate micronutrients and essential nutrients. So by an essential nutrient, I mean you need to get it from the diet. So carbohydrates are not essential nutrients. You can live without them. They're helpful, obviously, and they're good to have from an athletic perspective. But the essential nutrients come from these essential amino acids and from fats, specifically the polyunsaturated fatty acids, omega-3s and omega-6s. If you are a vegan, then getting more soy products, organic soy and quinoa would be a way to get some high-quality plant-based protein, along with nuts and seeds and a variety of colorful fruits and vegetables as well. So here's kind of a quick picture shows you what happens when you have the leucine. So leucine stimulates the mTOR, and that stimulates muscle protein synthesis. AMPK is that signaler that I alluded to earlier when you are in a fasted state. Maybe you train low, you don't have enough energy in, and that will block mTOR. So that's why when you look at that, there's a certain amount of interference between these adaptations that occur. So like somebody who's an endurance athlete and does a lot of endurance exercise, that can interfere with strength training adaptations. So that's why it's important to consider these things as you're taking in these nutrients, why you probably wouldn't want to fast or be in a low calorie state, because you're going to stop that muscle protein synthesis. And then the insulin on the left, just insulin comes from stimulated by carbohydrates. So that can help with reducing muscle protein breakdown in a sense, but also supports that mTOR production. So here is a plug for whey. So it shows how whey can augment satellite cell proliferation versus a placebo. So, and then we're looking at the, after an injury, what happens is your satellite cells are kind of the stem cells. You might have heard the term stem cell therapy. Well, your muscles have stem cells called satellite cells. And so they're really important in healing. And so if you want to start getting that whey protein in, if you're not averse to whey, or again, you could get the plant-based protein, but the idea is that you're getting a complete protein with an adequate amount of leucine in order to support that satellite cell proliferation and that stem cell production, which is going to be important for healing. So again, satellite cells there's muscle stem cells. They're really important for regeneration. And so when you think about it from if you're a therapist out there, if you do some mechanical stimulation, whether it's like from my perspective or my practice, it would be like deep tissue work or dry needling. And I do that in conjunction with some muscle protein, supplying enough protein, there's going to be a synergistic effect. Just like there's going to be a synergistic effect between having adequate nutrition and your training together. So, and that's where I might have somebody consume the protein before they come in for therapy.
Dr. Geoff, just want to do a bit of a time check. We're at about 5:45 and we have a couple questions. So I'll come back to the questions, but just want to let you know where we're at. So
okay, so I'm gonna whip through a few more slides here. So can I have 10 minutes?
Sure.
10 minutes, okay. So from a protein perspective, we want protein that's high leucine. We want about 3 grams of leucine per serving. From a protein intake perspective, we want about 1.6 to 2.5 grams per kilogram body weight per day. That equates to about 0.8 to 1 gram per pound. And you want to dose it upwards towards 40 grams per meal. Obviously, if you're somebody a little bit older like myself, you want to have more of that 40 grams because as you get older, you have that issue with needing more protein because you become a little bit more anabolic resistance. And you want to have that protein divided throughout several meals per day. And so this with protein, I'm just going to say a quick word about whey protein and casein protein. So there's slowly digested proteins like casein before sleep. So like cottage cheese or low-fat yogurt can be helpful to repair while you're sleeping versus the other types of proteins which are more immediate, especially like whey protein, which is considered a fast protein. Okay, I'm gonna whip over to fats. So basically with fats, important for energy as an energy source, especially for low intensity types of activity, important for hormones, and important from inflammatory perspective. So there's different types of fats. The gist that I want to go through here is that you want to make sure you're getting enough of the essential fatty acids, that's the omega-6 and the omega-3, especially a balance of having adequate omega-3. And that's where we're looking at alpha-linoleic acid, eicosapentaenoic acid, and docosahexaenoic acid in the omega-3. So you're going to get that from some plant sources, but also preferably if you can get it from salmon, wild salmon, grass-fed beef, omega-3 rich eggs, and so on. And you can see over here on this picture here on the far right, you have those types of fats from omega-3s that will be more anti-inflammatory versus the stuff you would get from all the refined types of carbohydrates and that are high, both in high glycemic fats as well as poor sources of seed oils that can be pro-inflammatory. Just quickly on fish oil as a supplement, so you can see that's helpful for tissue remodeling and repair and recovery. So basically for fat recommendations, you want to make sure you're getting high quality sources from raw nuts. Be careful with some of the nuts you can buy at some of the health food stores that have some seed oils in them, like a canola or peanut. Maybe preferably get your nuts raw. Get avocado, oily fish, cold water fish, some flaxseed oil, extra virgin olive oil, and then reduce some of the pro-inflammatory fats as well as factory farm meats that would be higher in poor sources or poor saturated fats and trans fats, which are highly inflammatory. Just quick word on micronutrients. So here we want to look at, you're going to find these once you start, like as we go up the pyramid, you'll find that as long as you're getting adequate energy, a balance in macronutrients, your micronutrients are probably going to be covered. And that's what we're looking at, the vitamins, minerals, colorful pigmented phytochemicals that have anti-inflammatory benefits. And then a quick word on antioxidants is a lot of times people will take high doses of micronutrients, and again, the idea is that they want to quench free radicals, so they want to take antioxidants. The problem is oxidation occurs as part of inflammation and occurs for a reason. It's the signaling, and that signaling is there to help your body to heal properly. So if you're taking high doses of antioxidants, you're going to interrupt that healing process. So you want to take a physiological dose of micronutrients, i.e. get it from food, versus a pharmacological dose through high doses of micronutrients that you'd find in a multiple. So again, should you supplement? Unless there's a dietary deficiency, you probably want to try and get it as much as you can through food. I mentioned about the antioxidants. Again, you don't want to get too high a dose. You want to allow the body to do what it's trying to do and support that. And you can get a good amount of antioxidants from a colorful diet. And as you can see, a lot of these micronutrients that are useful for healing can be found in a balanced diet, as previously mentioned. Vitamin D is one of those things that I tend to measure, especially with a lot of my patients, and you want to make sure that you're dosing based on labs. But if it's low, it can suboptimally affect the healing potential. And we get vitamin D mostly from the sun. There are some food sources, but supplementation can be necessary, especially in what I like to call the vitamin D deficiency capital of the world, Seattle. From a supplement perspective, creatine can be effective for supporting muscle protein synthesis. So that's a supplement that I'll recommend for some of my patients as they're going through the healing process. Dietary nitrates, we talked about beetroot juice, and if you were to take 250 milligrams a couple times a day, that can help with support inflammation, but stop some of the adverse activity of inflammation. Tart cherry juice is another one that you could use. And then polyphenol-rich foods. So here we're looking at dark chocolate, green tea, berries, all these colorful, you've got the theme, I think, of all the colorful fruits and vegetables that I mentioned earlier. And again, primarily for the micronutrients, you want to focus on diet if you can. If you are in a deficiency of vitamin D, obviously taking a supplement would be advisable. Omega-3 fatty acids would be another one, like fish oil, that I might recommend in a supplement. And then a couple more slides we'll go through. So gelatin is another one of those things that some people, obviously if you're a vegetarian, wouldn't be for you. But there's a researcher, his name is Barr, and he came up with a protocol where he would combine gelatin and exercise to enhance or improve collagen synthesis by increasing circulating levels of these proteins that are important for connective tissue repair. So his protocol was to use some gelatin, and you could get Knox gelatin, not my favorite, but you could get like Great Lakes or some kind of organic gelatin. So it's not that expensive. Take it with some vitamin C before you work out. And I'll have people do that before they come in for rehabilitation, and that can be helpful as well. Again, this is just more on some recipes and using that protocol. Obviously, fluid and hydration I haven't mentioned, but that's really important for the delivery of nutrients. So if you're in a dehydrated state, that's going to adversely affect your ability to heal. So here's some recommendations for men and women. If your urine, notwithstanding any supplements that you might take, is dark, then that would be an indication maybe that you're not getting adequate hydration. And then a couple more slides, nutrient timing. Again, in summary, protein, you want to have 20 to 40 grams per meal pulse throughout the day. Carbohydrates meet your needs based on your activity. So that's something that you might want to slowly increase as you're going through the recovery process. There's no really specific timing for fats. With the casein protein, I mentioned that's a slow protein, so taking that before sleep, that could be a useful strategy for healing while you sleep. And I think what we'll do is we'll stop here because that kind of, let's just go to, I'll kind of leave this slide up here so you can kind of see some of the general supplement recommendations, and we can go to some questions though.
Yeah, okay, great. This was a lot of really good information. We do have some questions. So related to inflammation, what are some signals that we shouldn't block the repair process?
You should never block the repair process. So basically, and when I had that first slide up, you can see that there's three different phases of repair. Inflammation's the first phase. So I would say like, I never encourage my patients to take, unless they're in an extreme amount of pain, and I believe that if they're going to move or there's a risk of some kind of instability, then at that point I'll probably make sure that they're immobilized. I'm probably going to refer that patient out, and then have them, take something to help with the pain.
Okay.
But you never want to block that.
Okay, thanks. We have a question related to supplements. One question here is, does glucosamine help joints?
So there's some mixed data on glucosamine. You notice that I haven't included it in this presentation. So where I get a lot of my my go-to for supplements has been through the sports nutrition certifications that I've gone through. So we're talking about big organizations like the International Olympic Committee, the International Society of Sports Nutrition, and what they do is they do these position stands, which is kind of like a meta-analysis where they pool all the data on studies on different supplements, and they'll rate them. And glucosamine is one of those things that's kind of never come up as one of those like things that is like evidence-based, for lack of a better word. I've seen some patients have said, well, I've used this. Some patients say, I can't tell whether it works or not. From my perspective, all these things that are on this slide right now are the key things for repair. You're going to get much more bang for your buck spending money on high quality protein and food than on glucosamine.
Okay, we have another supplement question. That I know there's a lot of runners on this call and a lot of high mileage athletes. You talk a lot about the food first approach, but is it really possible for a high volume athlete to get all of their nutrient needs from food, or is there required supplementation for a high volume athlete?
So getting back to that pyramid at the beginning of the presentation, I kind of always defer back to that. And again, that's kind of like where the evidence lies. And if you go to like that one research Eckendrup, or if you go to these position stands, and they're available online. Just if you Google International Olympic Committee position stand on nutrients, you'll see that the ongoing position based on the current level of evidence is that a food first approach is the best approach. So you can match your training needs and your training and your nutrition together by taking that approach. So like if you're an endurance athlete training for a marathon, and you can determine your energy requirements, and I kind of gave you a rough idea of how to do that based on some of the calculators, then at the same time, you can use like some of the diet apps that are out there in order to record your food and to determine that you're having enough energy coming in, and then and that'll also break down your macronutrients, your protein, carbohydrates, and fats, and so on. So I believe that you need to put as much energy into your nutrition as you do to your training. Because like I said earlier, you can't out-train a bad diet. And if, like where are you going to get, these micronutrients, you can supplement with them, but you can't push more with getting more. Your body can only use so much, right?
Makes sense. We have another question about inflammation. When should you use ice versus anti-inflammatory supplements or foods?
Okay, so this is an ongoing debate in my clinic, and so if somebody had surgery, for example, and they had like an orthopedic surgery or something like that, and there's a gross exaggeration of the inflammatory process because of the insult that's occurred to your body, then I would say go ahead and use ice. But I've compared what's happened when people have immobilized the area and used ice versus if you've gone in there and you've done some gentle massage and some gentle movement, and done contrast hydrotherapy. So contrast, as opposed to ice, is alternating hot cold. So you get a pumping action. You pump the nutrition in, you pump the inflammation out. It works a lot better. You could do that in conjunction with compression. So you could compress the area. So that's the only thing, a part of the RICE acronym, which is the rest, ice, compression, elevation, that I like, is if you compress and move a little bit, that can be shown to be helpful for getting rid of some of the inflammation. But again, you know, the only part of inflammation that's bad is the part that hurts, right? You have nociceptive fibers. These are pain fibers. They're irritated by these histamines and other chemicals that are produced. Why are they produced? Your body's trying to do something. It's trying to heal, right? If you had a light that came on in your car that said the engine needs some kind of repair, would you cut the wire or would you repair the engine? So basically, you know, if the inflammation's there, it's there for a reason, you know, let it be your guide, but don't stop it from being there.
So ice versus the anti-inflammatory supplements, none of them is what you're saying.
I don't typically, so I will recommend some supplements like curcumin, for example, could be one that you could use. There's been studies shown that it can help with the healing process, but I wouldn't use, natural forms of aspirin or just high doses of a nutrient meant to block something. Like I wouldn't really use high doses of fish oil to block something or any other kind of block. I don't want to look at a blocking action of inflammation.
Okay, still with the inflammation, is arnica gel a good alternative?
So arnica would be one of those topical things, right? So when we talked about meat, that's move, exercise, analgesics, and treatment. If arnica is an analgesic topically, that would be fine.
Okay. We have a question here that I don't totally, I'm not fully following. It's from Ethan, but it's a question about a balanced diet. And I think what he's asking is, can it still be considered a balanced diet if you have, for example, one type of food from a specific food group? So his example is breakfast with oatmeal and nuts and frozen fruit. Would it be a balanced meal or a balanced diet if you had breakfast with oatmeal and only one type of nut and one type of fruit? Or do you have to vary everything that goes into that meal?
No, but okay, so what I would say is like, okay, so you have your oatmeal, so you're having your good source of fiber and carbohydrate. If you had blueberries, then you're going to have a fruit that's rich in polyphenols. And if you had walnuts, you're going to get a good source of omega-3 fatty acids. So that combination is going to be like a great source of carbohydrates, proteins, and fats. Not as high so much in proteins per se, but more like in terms of carbohydrates and fats and polyphenols. If he wants to throw in some whey protein, now we're talking.
Got it. Great, thank you. Are there any other questions? Dr. Geoff, thank you so much for this informative presentation. Really appreciate your time and the knowledge that you're sharing with us, and it's really a huge benefit to all of us, so thank you.
Great, thanks for having me.
Well, thank you everyone else for joining, and like I mentioned, we are recording this, so I will post it up on the GritLink website in the next couple weeks. Until then, enjoy your virtual half marathon and celebrate this summer weather that we have, and get out there and